Dr. Siva Somasundaram for the past 10 years. So, I have some small introduction about our organization as well as our previous activities in the PowerPoint slides also. I would like to share. So before going to that, I would like to ask Dr. Saravanan is in call. He's also introducing. He's a cardiologist from Atlanta.
Thanks, Dr. Saravanan.
Hi everyone. Morning. Sorry, I'm on the hospital duty today, so just come in and go. It's nice to see everybody. I'll just give you a very brief thing just to get to the background of why we approached Dr. Siva. Dr. Selva Shanmugam and I have been working for over a decade in what we call in this part of the world as integrative medicine. I'm one of the integrative medicine board certified physicians also. So in chronic diseases, like it's mainly what we realize and see more and more is definitely the role of obviously lifestyle. Beyond lifestyle, there is a fundamental science that's been studied for thousands of years and documented. I'm sure many of you would have learned about it, but there's no kind of a good way of teaching it here in this country. And that's how we got more involved with Moro School of Medicine. And I've been a faculty in some of the universities before, and getting to the health sciences professionals, this knowledge is very important. So that's how we got to work with Morehouse, and I started getting students from there, teaching in their curriculum. And obviously, being my specialty being cardiology, this integrative approach is definitely getting momentum. And if I'm not political, I don't know much about the MAGA movement, but MAHA, I'm sure you would have heard about the Medicare and everything. And from the recent thing is Make America Healthy Again. It focuses a lot on the integrative approach. So when Dr. Silva is coming here, he comes here every year, and we definitely work with them on a continuous basis. And I was at Charleston for the last year, actually in West Virginia with Vandalia Health, working with my friend on one of those integrative projects. And when he said Dr. Shiva is in Salem University, I looked at it, and you guys really were somebody that we thought would be extremely important to talk to and see your interest in everything because of your Integrative Health Institute. So that's kind of the background why we approached Dr. Shiva to begin with. And so I'm just going to open the floor here so that we can answer the questions rather than being, because this is fairly new to us. So maybe Dr. Silva, like if we can just let them kind of ask us the questions and we answer,
Yes.
then we can go for a formal presentation or something like that.
Yeah. It's nice, Dr. Silva. I'm okay with that, Dr. Silva.
Dr. Nelson, do you have any?
Hi, Nikita Nelson with the School of Nursing, and I'm also a board certified women's health nurse practitioner. So I live in Florida and then working, West Virginia, and we're in a rural area, and so there's a big push, and pull to get our nurses, more integrated. Integrated medicine fits right in. How do we work in our rural county for rural health medicine? So I would be interested in how we can have any kind of particular partnership where our nurses could have some part in our curriculum, some part of training or education, where we're getting, that experience and that exposure to integrative medicine. So right now, our programs are LPN to the ASN, licensed practical nurse, traditional associate degree nursing. Then we have an RN to BSN where they're doing a capstone project. That's an opportunity there. And then, but our areas for the master's levels, not at a provider level, they're actually for education and leadership, but for where our interest might be, greater pool may be for our nurses who are going into that practice of being trained as those registered nurses going into the first line of practice.
Perfect. So what I've seen definitely now, because I also span across what we call a health informatics and digital health and chronic care management and things. So I also have a digital health platform that we coach people and take care of people in the remote areas too, because our interest is definitely rural health and global health. And that's why we got into this field. And so we do remote patient monitoring and all those things. But what really is happening, especially in the US healthcare, is there's definitely going to be more and more push towards population health. As you know, it's going to be people sitting in some places, calling, monitoring, and everything. And there are a lot of reimbursable care programs that's been introduced by Medicare, obviously by other insurance companies. And there's some new programs called access models and everything coming in. So the new generation of nurses and even medical assistants and health coaches, they all need to be, in my opinion, be very well trained in this, because that's how their work is going to be, especially with the AI coming in and everything. There's going to be a lot of this needs to be, they need to be, get ready for these things. And especially in a place like West Virginia, where we really envision is a lot of those local teams need to be trained to take care of people in the community, right? Because as you know, when I worked there for a year, the the culture is different, even compared to Georgia or where I worked before in Missouri or California, right? So it's very, very important to get those things there. So that's why I really thought I was very excited when I saw your initiative on IHI and focusing on nutrition. And the other thing was that even in the sports physiology. So I don't know, how much do you know about the other aspect of like we used to call them CAM therapies, we used to call this, we used to call that. There are many names given to this integrative medicine approaches. The allopathic system is there. And then obviously the well-known, for lack of better terminology, the complementary and alternative therapies definitely include one thing commonly known, Ayurveda is something people know from some of the part of the world, like India part. Siddha is one Chinese medicine, and then the African part. But most of the time, Ayurveda and Siddha are Chinese, being the most published ones. Siddha is coming up with that part. A lot of similarities between Ayurveda and Siddha. But I really want to understand your team's understanding of, because I don't want to be preaching to the choir if it's something that
Yes.
you all know already.
No, my most of my practice was with the in the military and Air Force. So, we were limited on what, there wasn't any additional traditional medicine that was going to be outside complementary. If I had to send patients, with women's health and, hormones, that sort of thing, I would have to refer them out for those type of complementary therapies. So I don't have a whole lot of experience with complementary medicine. Now, we do have our health coaching certificate program also at Salem, and that Dr. Storms is going to be taking over. But I think that might be another opportunity as well, as they're getting those certificates, and they can sit for at least that certification for that. And that's growing. I understand health coaching is really, a growing
Yes.
market as well. Now with the Air Force of Population Health, we had our own disease managers, of course. So I understood, that management where we had our nurses who were, it might have been behavioral, it might have been disease manager, where they had a certain big populations of patients who had diabetes or heart disease, managing medication. They saw those disease managers first, forever having that contact with the provider. And with not nursing has kind of changed on this telehealth aspect, where now nurses are typically required to have at least 2 years experience before they can be to do telehealth. Even though there are algorithms that are used, they do need to have those 2 years of experience. But we are actually trying to get them that exposure prior to, going into the workplace. So I was actually on with Shannon, who's going to be working with our looking at grant opportunities. How do we partner with maybe another type of practice there, where we can say, now we can write for grants, get this partnership, get our nursing students to be trained in type of, like, whether it's integrative or telehealth or rural health. But for us being a private institution, we're going to have to establish those partnerships. So it is glad to have you guys on board as we're looking to write these grant opportunities. Is there opportunity? And now I do have that position in the collaborative partnership, that we can say, now we're not trying to work independent, we have a partnership.
Perfect.
And I
That would
probably
be
went way off
wonderful.
on the tangent, but I do get excited about, medicine, having a family full of diabetics and hypertensive. My siblings, all of us were hypertensive by age 35. We were all on
Wow.
medications regardless of our
Yeah.
weight and our activity level. My brother and I are both retired military. But even though we were running and jumping and hauling backpacks, we were on hypertensive medicines.
Yeah. Yeah, that's definitely one of our areas of interest because hypertension, the heart failures, and this diabetes, they all go together. Right? So we call this as a cardiometabolic area, which is very gaining momentum now. Actually, have you applied for any of the rural transformation grant from your side? Because we did make, when I was in Vandalia, we did apply to the West Virginia. You know, you haven't, okay.
We
Because,
haven't, but I'm
yeah,
looking to
We
do
can
it.
try.
perfect. So I think I'll let Dr. Siva and Silva talk. But what I see is like definitely there's so much alignment because it's definitely an extensive subject. Very good. And Dr. Silva comes here in a couple of weeks here, even the next week, most likely because of the war, he's getting delayed. We really want to kind of set up some in-person discussions, right? Because I would love you to understand the little bit depth of this knowledge because this is not something people are very aware of. And in addition to that, the expertise, what from our side is, we do not see this two separately, right? Because obviously we have a good group of faculties in cardiology and anything you name from this side, then on that side, from the complementary side. So we would like to come as kind of a group and say like, look, this is what we can bring in because the training should come from both sides, right? Somebody who is well versed in the modern aspect of medicine and understanding the other aspect of medicine, which is very difficult in this country because we're very good at modern medicine. But to understand the other medicine, you really need a deep knowledge. And most of that knowledge is written in a different language too. It's not something that people can understand and things. So that is where I really feel the best things would happen. And that my thing would be definitely your university is very aligned with that part. And being in West Virginia, to be honest, I gave a presentation there. Unfortunately, it's the worst state in disease, right? I think it's the most disease burden in the country. The way I thought is like there, things can get only better, like because it's so much worse there. When I was, it's so simple to see people with high blood pressure, heart attacks that engage itself. Right, in West Virginia is one of those areas. So I'll stop here, but that's our excitement why we reached out to Dr. Siva. So I'll stop here and let Dr. Siva and Selva take it from here.
That's fine. Thank you, Dr. Saravanan. And we can submit like a research grant for the complementary and alternative medicine from NIH. There are a lot of grants available for the, especially for the nursing, and because we have the nursing school. So with that, and part of it, we can do some research, and then scholarship money we can pay to the nursings. So that new students, because of the new discipline, and they will get a scholarship for that if we start working on that. And Dr. Silva, he can contribute for that alternative medicine. And you can, of course, you can also contribute as a faculty member, onto this particular grant proposal. So that's what my idea of the collaborations with that. So we can provide for our space and as well as for the facilities. And we can extract the money from NIH or any other foundations, and then we can do until start with. But now we can offer a couple of classes, couple of chapters for my course. Dr. Selva Shanmugam is doing that. But eventually you can have a specializations and you can be like like an adjunct for our Salem University. So you can teach one of our courses. So that's what my opinion on that one. Where the nursing students can also participate one or two classes on that as an elective if they are necessary. That's what my request.
I love that idea. Right now for that bachelor's of nursing program, I'm definitely writing in that opportunity to have those electives, and then that they'd be able to choose those, that additional those courses where it's definitely paid for with their financial aid, and they can see what else is out there for me as I go on this trajectory towards being a professional nurse. So this is all very exciting to me. I'm a lifelong learner, so
Yeah. Dr. Selva Shanmugam, he got already a 4 weeks courses already made, and then he is teaching to the Morehouse. So that is, we can adapt and then modify, and then we can submit our curriculum committee, and that the same thing we can apply for the grant for the NIH. So these are the courses which we are going to apply, and we need more nurses onto this particular discipline. So we want to recruit. So that's what my point is, more enrollment and more discipline and the new approach on that. Thank you. Go ahead, Dr. Solution.
Thank you. Dr. Somasundaram, is it possible to share my slide?
Yes, you can do that.
Please make me the co-host.
Co-host, I don't know how to do that one here.
Okay,
And that hearts
that's
tool.
not a problem. Okay.
Yeah.
Go to
But Dr. Silva, when you're
participants at the
getting that
bottom.
ready,
Mhm.
Host tool, yeah, I can see the host tools. And then in that one, enable waiting room, share
And so if you go to
notes.
participants and click on his name, it should allow you then to change it.
Oh, on his name? Oh, okay.
When you look at participants list.
Okay. I just I couldn't get that one here. I don't want to. Yes.
So, no issues.
Make
I
host.
will.
Yes. I can see that. Yeah, make host. Do you want to change the celebration one? Yes.
Yeah.
Thank you. Now I
Oh,
know.
okay. Okay, thank you. So,
and Dr. Todd and Dr. Nelson, quick thing before Dr. Silva starts, and because I might have to leave for the hospital thing, on the nursing part of it, like the job placements and things like that. So do you see any things that would make them much prepared for the job force? Because the reason I'm asking is two things. One, the Vandalia Health System in West Virginia, that's one area that I worked with, and obviously they always look for well-trained people and everything. The same thing with where I'm working in Georgia and things like that. There are many, the job placement, has that been a priority in the institution, or what would be your ask, or if you look for something in the next year or so?
Yeah, that
What's
is actually I was on a call with Vandalia Health yesterday and the chief nursing, and we know they have that big shortage. How can we bring in a bigger student body population so we can produce more nurses? But then they're looking like, where all can we place them? They got the home health, they're looking for nurses, and that's that rural area. So there's definitely job placement as part of this, yes.
perfect? Wonderful. All right, great. All right, thank you. Go ahead,
okay,
Dr.
thank
Silva.
you. Okay, thank you, Dr. Saran. Okay. So, is it visible to all of you on the slides?
Yeah, we can see that. Yeah.
Okay, so good morning, everybody. Thank you for arranging this very nice meeting. I would like to say something about our organization as well as our prior activities related with integrative medicine. I would like to share some slides with you. So our organization is called Health India Foundation. This is a Center for Integrated Traditional Siddha Medicine and Modern Medical System, founded by a modern medical professor who is a former consultant for WHO. It is a charitable organization running integrative Siddha and conventional medicine hospital at Chennai in India since 2002. In our hospital, more than 38,000 patients have benefited from this integrated medical approach. We are integrating Siddha medicine as well as the traditional medicine with the modern medical system. So we have memorandum of understanding with the renowned universities in India and abroad also. One of the major universities is the Manipal Academy of Higher Education in India. The another institution is the integrated medicine introduced in Morehouse School of Medicine, as Dr. Somasundaram mentioned in his discussion. He mentioned about the Morehouse School of Medicine. So we have a MOU with the Morehouse School of Medicine. Currently, we have 3 Siddha Medicine integrative course in Morehouse School of Medicine. One is the 4 weeks elective in-person course exclusively for the 4th year medical students. This is in-person course. The students may come to India in our hospital. They stay here for 4 weeks. This is the 4 weeks elective course. Simultaneously, we have the 4 weeks online elective course exclusively for the 4th year medical students. So another one important thing is 8 weeks online course for the physicians, medical students, staff nurse, and paramedical staff. This is the basics of Siddha system of medicine and the non-pharmacological approach and some non-invasive investigative parameters of Siddha system of medicine are the segments of this 8 weeks online course. So I am the faculty member of that Morehouse School of Medicine as an adjunct faculty. So in the fourth year medical elective course, the course director, Dr. Rajagopala Sridharan, is the professor of physiology in Morehouse School of Medicine, and the course director in India, myself, on behalf of Health India Foundation. So these are all the 4-week in-person course in Chennai and the Manipal Academy of Higher Education. The course objective is integrative medicine. They learn the fundamentals of traditional the system of medicine, fundamentals of disease approach, and understand the non-pharmacological approaches, especially the Barmum therapy, energy point stimulation therapy, is related with, it's closely associated with the acupuncture therapy of traditional Chinese medicine. So Siddha culinary medicine is also a very important part of this elective course, and Siddha yoga therapy is also a part of this course. So the students will learn from this course the basis of Siddha system and the Barmum therapy, yoga practice, Siddha non-pharmacological treatment for the challenging diseases, and Siddha treatment for the diseases like challenging conditions like diabetes, hypertension, cardiometabolic health, and some challenging autoimmune disorders like psoriasis and rheumatoid arthritis. So Siddha traditional preventive method is very, very important. So the primordial preventive method based on the Siddha lifestyle is also a part of our curriculum. And most importantly, cultural exposure is very important part of this course. So each and every year, 4 medical students are coming here to learn this course. So it is accepted and approved by the Indian Consulate General of Atlanta. And these are all some activities during the 4 weeks elective course. So they learn the Siddha Yoga as a part of our curriculum. They learn the Siddha Yoga as well as the Siddha Yoga therapy. The yoga therapy is useful for hypertension, anxiety, and other psychiatric issues. They are ability to give treatment through the yoga therapy. This is exposure to the other universities and other institutions. This is Barmum therapy, the energy point stimulation therapy. Our body has some more than 100 energy points according to the ancient literatures. So energy stimulation, they are learning the specific points, identifying the specific point and the stimulation method. The third is the important thing, that is how it acts in the disease conditions. So it is very effective in musculoskeletal disorders, psychiatric disorders, and other challenging conditions. It is not a separate therapy. It is also useful for the complementary therapy with any other medical system, not only the Siddha system. It is also complementary to the modern medical conventional system or any other traditional medical system. It is go along with the treatment. So the main part is the culinary medicine. They are also learning the pulse reading examinations. So the Siddha traditional pulse reading is very, very important part. So there are 3 energies. The life force energy is identified by the simply examining the pulse wave of a patient. So the students are all having the opportunity to give the treatment in the underprivileged area of our India, as well the Tamil Nadu, as well as the Manipal Academy of Higher Education. So the free medical camp is arranging during the 4 weeks course. And in the part of cultural exposures, traditional Tamil food related with the medicinal benefits are also they learn. They are also exposed to the cultural exposures in various places to visit in and around our Chennai, as well as the Manipur, Karnataka, the neighboring state. And some festivals, they are able to learn the festivals of our tradition. It is closely related with the health condition and the primordial part of our system. So during this 4 weeks, the Siddha Walkathon, 5K Walkathon is also is a part of this our curriculum. And these are all some other activities during the system. So they are able to give therapy using the non-pharmacological approach, especially the energy point stimulation. The practical session is also very useful for them to learn how to treat the musculoskeletal as well as some psychiatric issues related with the Siddha system of medicine. So Siddha culinary part, the homemade preparation, home remedies as well as the Siddha culinary part. In some disease condition, the Siddha diet is also useful to reverse some conditions, especially in cardiometabolic disorders. Along with the conventional therapies, integrate the Siddha culinary part is very effectively overcome the disease conditions. So these are all some other external therapies they are learning. One of the important thing is leech therapy. Leech therapy is approved by the US FDA. You know more about the leech therapy, I think. So these are all the medicinal manufacturing company visit. They are fortunate to learn how to prepare the traditional medicines and some other cultural activities. This is important thing. The medicinal plants in nearing health institutes as well as the universities and National Institute of Siddha, our organizations are arranging to visit the medicinal plants, and their medicinal benefits are also they are learning. And this is another important area, Autism Institute. This is other institute in Chennai, the Swabiman. In this institute, they are learning. 1 minute, I admitted some. Okay, right. They are learning how to treat the autism spectrum disorders through Siddha medicine along with the energy stimulation, that is a Varmam therapy. They are learning, and they are able to visit some other institutes in Chennai, and also the cultural exposure and the medicinal benefits. So our other area of interest is Siddha Wellness Retreat. This is our strength of other strength of our organization. So we are conducting wellness retreat. So in this retreat, Siddha lifestyle, Siddha breathing techniques, Siddha yoga therapy, and Varmam stimulation, Siddha culinary medicine also a part of this wellness retreat. So 3 days to 7 days wellness retreat we are conducting all over the world, especially US and Malaysia. So in-house, the residential program, the morning 5:30 to evening, we are giving some theory part as well as the practical part in the Siddha culinary medicine, yoga part, Varmam stimulation, and other non-pharmacological approach. We are giving the therapeutic approach to the general public as well as the medical students and medical doctors also. So at this juncture, I stop my presentation. If you have any questions, please ask me. Thank you for this opportunity. Thank you so much.
Love it. Well done.
So we can make, if possible, write an MOU with Dr. Talton, and then we can send to him, and then we can revise it with Dr. Saravanan as well, and with our official, with Dr. Christine Strong for our dean to follow it up. Now we can, certainly we can do some collaborations. That's what my opinions on that.
Dr. Saravanan, if you add anything beyond my
Training.
presentation, you can share,
Yeah.
Dr. Saravanan. Yes.
Sure. I think the way I would look at it is obviously what he talked about is geared towards people coming and learning from the medical school and everything. But this fundamental knowledge can be taught to anybody. And not people doesn't have to go to travel. They obviously if they want to go travel and experience, that's always available. But not everybody will be able to go there, right? So that's why I think the online part of it is there to teach the basics of it. And in addition to that, we have developed some relationship with people and institutions here. Even in the Charleston Area Medical Center, the cardiologist and I have worked there and established a chronic care program, which incorporates a lot of the mindfulness part of this into into the contemporary health system in the US. And they are part of chronic care management, and it's getting only better and better because the reimbursements are there now. It's showing effectiveness, and we can do also some pragmatic research on it. The one thing we do is in April 12th and 13th in Dallas, we have a 2-day retreat that we have arranged. Maybe if any of you are available, to be honest, you can even come and join us there to understand the foundation and everything. But that's what I would say is like the next best thing would be for Dr. Silva to visit there and at least sit and talk and explain a bit more. Would be a reasonable thing to do before even anything. I'll leave it to Dr. Shiva to take it from here and Dr. Swarman.
Thank you, Dr. Saravanan, and thank you, Dr. Solution, and thank you, Dr. Christine Strong. And then I think I talked with Dr. Jenny Greathouse, and as well as for the Dr. Talton, so we can think about draft a particular MOU, and I think we have a model, right? MOU model, and then we can explore further. Can discuss with Dr. Nelson as well, and what the possibility of writing grants and recruiting more students, and even Atlanta and other places, as you have already established the other states, right? So we can explore that possibility as well as a Salem student, right? Though they are in other state, we can explore that. So that's what with that. I thank you everybody for this, and that's encouraging and collaborations on the meetings, and look forward to contact you all. Okay, thank you.
Thank you, Dr. Steve. Thank you, Dr. Silva.
Yes.
You have a good day.
Thank you.
Thank you so much. Thank you so much, Dr. Siva Somatram, for arranging this meeting.
Yeah.
And thank you all. Good day for you all. Thank you, Dr. Saravana.
Okay, see you. Bye-bye. Okay.
Bye-bye.
Bye.
Yeah. So, thank you. Everybody's there.